My second point, which is one about testing. I know that the government is looking to bring forward testing. Can I ask the Minister what the government is going to be doing to prioritise testing? The World Health Organization have made it clear that we need to test. We cannot manage what we don't know. But in so doing, I think it's very important that we're very clear about the priorities and stratification as to who gets tested first. And in my view, that should be the most vulnerable. It should be those people working on the front line in the NHS and in other areas. Can we have some more assurance about the timing of that testing and how it's going to be prioritised? Moving on, I should declare an interest as the about-to-be incoming chair of the NHS Confederation, and in preparing for this debate, I have sought feedback from NHS Confederation members about the COVID bill, and of course there continue to be concerns about PPE supplies. The government needs to work closely with NHS Confederation and providers in ensuring that supplies are available for those in most need on the front line. I am receiving emails from doctors, from nurses, who are very concerned about the supply of PPE to them and their colleagues. Testing, of course, I have already mentioned, it needs to be ramped up for all staff, and staff in the NHS need to be prioritised. We welcome the £5 billion emergency fund in the budget for public services, but we need to ensure that money can be accessed quickly to manage additional workloads and to cover for absence due to staff sickness, and relaxing the rules on PCN underspends would be a positive enabler of this. There is also a further need for care and nursing home staff who require training and preparation at scale, which will be difficult. I should mention the efforts being made to make transport more available for those staff on the front line. I am concerned about reading reports that reducing transport has an impact on staff who work in shifts, particularly in London, and we are reports actually of overcrowding. Before I leave this particular issue, can I note the self-employed? Now, notwithstanding the government statement on the self-employed, I am concerned because I am aware that people who are self-employed in the health and social care sector are feeling forced to go to work in order to put food on the table. Now, I note the comments made by the Minister on self-employed, and of course Shakespeare did write some wonderful works during a time of stress, but I note he had a patron. These people do not. And it is very, very important, not just for their welfare, but for the welfare of all of us, that people are not forced into a position where they have to work in order to feed and put a roof over their kids. So I really do hope that those proposals are brought forward now, and that the particular rigour is focused on those in the health and social care sector.